Assalamualaikum and hi, my name is Nur Idina Sofia Binti Hafiza. I am going to present about pathophysiology of inflammation and pain. Inflammation is a defensive response which causes different physiological adaptation which it will limit the tissue damage and remove pathogenic insult. It will cause series of events which is dilation of arterioles, increase the vascular permeability, and promote migration of leukocyte to the inflammatory area. Inflammation can be divided into two parts, which is acute inflammation and chronic inflammation. Acute inflammation is only occur for a short period of time and it will resolve for only 2 weeks or less. Example of the acute inflammation is cut on skin or having a sore throat. Meanwhile, for chronic inflammation, it is a prolonged duration and it is caused by persistent infection and prolonged exposure to the toxic agent. Example of chronic inflammation is arthritis. Next, I will talk about pain. Pain is one of the cardinal signs of inflammation where it is a response to the immune damage or infection. Pain is a result of complex sequence between signaling system modulation from higher center and perception of individual. There is two types of pain, which is neuropathic pain, where it is caused by disease or damage that affect the nervous system and spontaneously occurs. Example of the neuropathic pain, the disease that occur after a stroke or nerve cut. Meanwhile, for nociceptive pain, there is two types of pain, which is somatic and visceral pain. Somatic pain occurs in deep tissue, where it is a sharp and localized pain. The example of somatic pain is muscle pain. Visceral pain is innervated to organ, and this type of pain is transferred from surface to the body. It will cause a throbbing and deep pain. For example, cramp, changes in heart rate or blood pressures. Let's proceed to talk about the mechanism of action of the drugs for inflammation and pain treatment. The non-steroidal anti-inflammatory drug, which called NSAID, is widely have been used because its properties that against the all form of inflammatory conditions such as angioedema, headache, and ulceration. The main mechanism of this NSAID drug is the inhibition of cyclooxygenase enzyme. The main function of cyclooxygenase enzyme is to convert the arachidonic acid into the thromboxane and prostaglandin. The two types of cooxygenase enzyme is cooxygenase 1 and cooxygenase 2. Both of these produce prostaglandin. The main function of prostaglandin is to promote the inflammation, pain, and fever. Meanwhile, the thromboxane function is play roles in platelet adhesion. This therapeutic effect of NSAID drug is attributed to the lack of eicosanoate. Briefly, ibuprofen is an NSAID drugs that works by blocking body production of certain natural substance that will cause the inflammation. Thus, the ibuprofen therapeutic effect will help into reduce pain, swelling, and fever from our body.
Mechanism of action of herb, which is Curcuma noga. Curcuma noga has a yellow pigment called curcumin. It has curcuminase as the major active constituent. It exhibits a wide range of therapeutic properties like anti-inflammatory, antioxidant, anti-cancer, and others. Curcumin acts as an anti-inflammatory by inhibiting COX2, INS, LOS, and INOS. These are important enzymes that mediate inflammatory processes. Most studies found that curcumin has the potential for curing inflammatory disease as it blocks the mechanism of reactive oxygen species generation via inhibiting oxidative stress. It has prominent effect on inflammatory mediators like cytokines as it blocks the oxidation process in mitochondria of the cell and reduces inflammation. Alright, next, I will talk about the expert opinion on the current and mostly used animal model for the inflammation and pain, which is carrageen-induced hypoedema or RAD. The expert said that if the study conducted on the animal model, it will be quite costly and the study will take a lot of time and it has to go to the clinical trials. The person conducted the study also need to know the animal care and the restraint. In addition, there is also a new method for the study of inflammation and pain, which is in vitro bioassay. The in vitro bioassay is a study conducted not on the animal, but it is on the cells. For example, is the lipopolysaccharide LPS stimulated raw 264.7 macrophages and human monocytic leukemia cells. Both of the studies are used to assess the anti-inflammatory effects of the phytoconstituents. Carrageen-induced hypoedema or rat is still relevant for the future study because this drug treated will be used on the human. So, the study conducted should be conducted on the living organism as well, such as on rat and mice. But is it because we need to know how the body reacts towards the drug and herbs and the efficacy of both treatment. Lastly, the result of the study would be more accurate.
Hi, I'm going to present about wound healing. What is wound? It is a circumscribed injury which is caused by external force and it can involve any tissue and organs. In other words, wound is a damage or disruption to the normal anatomical structure and function. Wound range from a simple break in the epithelial integrity of the skin, or it can be deeper, extending into subcutaneous tissue, with damage to the other structures such as tendons, muscles, vessels, nerve, parenchymal organs, and even bones. This actively demonstrates that wound can occur externally or internally. Meanwhile, healing is the body's response to an injury in attempt to restore the normal structure and function. In other words, wound healing is the replacement of destroyed or damaged tissue by newly produced tissue in a living organism. In wound healing treatment, the drugs that we often use is intrasite gel. Intrasite gel is a clear, amorphous hydrogel containing a modified carboxymethyl cellulose polymer, propylene glycol, and distilled water. The mode of action in intrasite gel is by promoting natural debridement through autolysis by gently rehydrating necrotic tissue. It can also be used to provide the optimum moist wound management environment during the later stage of wound closure. It is non-adherent and does not harm viable tissue or the skin surrounding the wound. This makes intrasite gel ideal for every stage in the wound management process. Let's proceed to the mechanism of action for herbs in wound healing. Anthrodia camphorata is a parasitic fungus from Taiwan. Prior research has documented that Anthrodia camphorata possess a variety of pharmacological functions like anti-inflammatory, antioxidant, anti-proliferative, and anti-metastatic. Anthrodia camphorata extract significantly enhance the rate of the wound enclosure in rats and promotes the in vitro healing through fibroblast cell proliferation. Wound dressed with Anthrodia camphorata extract show remarkably less scar with at wound closure, and granulation tissue contain less inflammatory cell and more fibroblasts.
Hi and Assalamualaikum warahmatullahi wabarakatuh. Today I would like to share with you about animal study. We also already interviewed someone who is expert in this field. His name is Professor Dr. Mohammed Abdullah Mahdi Al-Shawsh, who is currently a professor in University Malaya, Malaysia. From our interview, a study of incision model of wound healing was tested in vivo by using 4 groups of adult Sprague daily rats. Okay, for this study, he said he's used rat. Also, the drug is anthracite gel, and for the herbal extract is Anthrodia camphorata. Okay, for this study, he said first of all we need to shave the foot of the rat, and then we need to sterilize the area, and then we need to mark a stem mark. Okay, and then we need to cut off the skin, follow the stem mark with a 1 cm to follow the stem diameter, and then we need to spot the skin. Okay, after that we need to write on the drug such as intrasite gel, or we need to give oral by using oral gavas for the herbal extract Anthrodia camphorata. Okay, and after that we need the observation duration for this wound healing is 14 days. Okay, during this interview we also asked him, is it still relevant to use animal study for wound healing for the future study? Okay, and his answer is yes, it stay relevant because if there are a wound occurs to the human, especially cuts, it can be applied because the same step in the wound healing in human and also rat. There is maybe a genetic and physiology difference between rat and human, but the procedure of wound healing such as coagulant phase, inflammation phase, proliferative phase, and remodeling phase also is the same. So it's the best way to treat wound healing, and is the best way and the best method by using a rat also. Lastly, we also asking, is there any new method can be used for wound healing? He say there's new methods such as scratch assay, which is evaluate in the vitro wound healing in the fibroblast cell. Which is we take a cell from the rat and then we transfer it to the culture, and then we are going to scrap and use any drug or something.
That's all from us. Thank you for watching.